Hello guys, talking about scars, acne scars and how to get rid of it. Stay with me if you want to know more. Okay, hello, my name is Dr. Liv, actually Dr. Liv Kraemer, but everybody's calling me Dr. Liv. I'm sitting right now in my beautiful office, boutique clinic here in Zurich, and I thought, okay, let's do a couple of videos. Some topics just came in mind because some patients asked me, and so I decided to talk about acne scars, because most of you guys who had acne and who couldn't take their hands out of your face because you started picking, unfortunately there are scars develop. And what are actually scars? Okay, think about you have two parts, right? And if the parts are cutted, they're pulling apart. So what's happening, because your body is very, very intelligent, their body don't want to get these parts far away, because then a lot of bacteria can go actually into your body. So the skin is the protective layer, and your body wants to keep it very kind of smooth and very stable and therefore closed. So what's happening if you cut yourself, and cutting means from the outside or by disruption from the inside after a pimple, so these two kind of parts, they are, because of shear streets, because of pulling, they're getting apart from each other. So now you think things, help, distraction, we don't want to keep these two parts away from each other. Suddenly the police is coming and all are helping to kind of produce a certain substance called the not good collagen, because the fibers are not really cross-linked, they're more like parallel. So suddenly you see a scar tissue, right? The scar tissue does not have hair, it does not have any sweat glands, it looks just like kind of a glue. And it is kind of a glue, because your body really wants to glue these parts as quick as possible together. So a scar is developing. And if you cut yourself, of course this is happening, and cutting from inside out, it's the same. So if you're kind of suffering from acne and there's a huge kind of inflammation underneath, and if you kind of trying to just get this junk out, you actually hurting your skin, and suddenly it becomes a channel out where it doesn't supposed to be going out, and suddenly the skin thinks as well, help, destruction, and is trying to seal it. So a scar is developing. And unfortunately, as all you guys know, with time, with age, these scars, particularly the acne scars in the face, are becoming worse. So unfortunately, one thing, there is nothing on earth which removing scars, but there's hope, because there are some methods which making scars looking better, so that most of the time you will not see it eventually, particularly if you do it as soon as possible. So let's talk about acne scars. Oh, scars are like iceberg. There are two ways of scars. Either we call it hypertroph on top, like a iceberg, or atrophic, which goes like inside. But let's let's make it easier, it is like an iceberg. So what you try to kind of destroy this iceberg with an ice pick. It's happening, the new water is coming out, this iceberg gets flatter. So this is happening with your skin, because as soon as you're hitting with, for example, microneedling, these are your needles, for example. So if you're having small little needles, almost like acupuncture needles, then you're actually hitting the skin in a very defined depth. Please, just let this do a dermatologist with you, because if you're not using proper micro needles, you can harm your skin. But you don't want to harm your skin, you want to actually get then an impulse. What does it mean? Okay, so let's go back, not confusing. You try to get these hard scar get smoother, and this you do, as I said, as with an ice pick. So the microneedling is going into the skin again thinks, oh my god, distraction is producing growth factors, and because there is no pulling apart, because it's just a stimulus, right? There is nothing to serve. We just do as there would be a damage, but it's not really a damage. And so for the skin has time to produce the good collagen, right? And the scar becomes softer and less visible. And there are different other methods combining. There is a fractional laser, which means with the heat you try to do small holes into the skin and keep it heat in the depth to get a tightening, because collagen is like a spiral and it gets enlarged. With heat you shrink it. It's like washing a dress hot. So ideally, it's actually not using a fractional laser. I love the micro needling radio frequency. What does it mean? Because if the needle goes in, it's old method, but now a medical device, so it has to be done by a dermatologist. And if the needle is inside, it gets a heat impulse, and through the heat impulse, you get also a shrinkage of collagen, therefore tightening. So with age, as I said, the scar is very hard and the elasticity is loose, so you see it more. With this method, this gets softer and this tighter, and suddenly you see the scar less. Okay, summarizing, I like really using for acne scars with no kind of inflamed lesions, so no heavy pushing acne, so it's kind of the end of the acne. This is just like finished. You just have these scars left, the icebergs, and these you can kind of get softer, get less visible with these dermatological medical devices, microneedling, and in combination with heat, so as radio frequency is definitely an option, but speak to a dermatologist about what he thinks is best for your skin, because this is the best way to really get the best treatment and the best result out of it. So don't try something from the internet. Please, please, girls and guys, don't do this. Go to your dermatologist and get some advice, okay? Thanks so much. Subscribe to my channel. Give me some likes, guys. Follow me on my social media like Instagram, Dr. Liv. I hope I give you some nice information. Switch me on if I say Dr. Liv, because I just love beauty. Okay.